Good afternoon and welcome to Weathering Uncertainty, Climate Change, Stress, and Mental Health. It's a virtual event from MindSite News and Call to Mind. I'm Rob Waters, founding editor of MindSite News, the country's only national news organization devoted solely to mental health reporting.
And we appreciate you. I'm Angela Davis, the host of Call to Mind from American Public Media. Call to Mind is this national mental health public radio series, and now it's also a podcast. And what we do is that we explore the critical mental health issues that are really shaping our lives.
So, Americans today are pretty stressed about political divisions so intense that some family members can barely be civil to each other, about workplace pressure that often seems so overwhelming that people feel dread every time they head to their office or get ready to participate in a meeting, about deepening economic concerns that they won't be able to pay their rent, buy food, afford a healthcare procedure, or fill up their car.
Yeah, and on top of all of that, we learn almost every day about the impacts of climate change, how wildfires and severe storms, record-breaking heat are all destroying people's homes, as well as crops and livelihoods, as well as triggering respiratory illnesses and cardiovascular disease, as well as creating these waves of climate refugees who are looking for new places to live.
Over the past month, Call to Mind, our friends at Call to Mind, released a series of special episodes for Mental Health Awareness Month. Two of them focused on the mental health impacts of chronic stress and of climate change. So MindSite News and Call to Mind are joining forces to discuss these issues in this live virtual event. In this webinar, we're going to explore these issues with a distinguished panel. This includes Call to Mind's senior producer, Jessica Bari, who led the creation of these episodes. Good afternoon, Jessica.
Hi, thanks for having me.
And also joining us today are two researchers and educators who have looked at these issues in depth for years. Gale Sinatra is with us. Gale is a distinguished professor of psychology and education whose work focuses on climate science education and public understanding of science. Good afternoon, Professor Sinatra.
Thanks for having me.
And Thomas Doherty is an internationally recognized clinical and environmental psychologist known for his research on climate change and mental health, and his work with clients who are coping with climate anxiety. Greetings to you, Dr. Doherty, and thanks for being with us.
Thanks, Rob. I'm really glad to be here.
So people in the US have experienced really historic levels of stress since the COVID pandemic started in 2020. Indeed, the mental health impacts of the pandemic are really what prompted me and my colleagues to launch MindSite News in 2021. To kick things off, Jessica, can you tell us what prompted you to want to devote a program to the subject of stress?
Yeah. So stress is a topic that I've wanted to spend time on for a while. I think that it's one of the most under-acknowledged reasons for general health issues and certainly issues with mental health and well-being. Organically, as somebody who covers mental health, stress is something that comes up in so many stories that we do and mental health conversations that we have. And stress is something that we all have just by being alive. And so as somebody that is doing programming for a public radio series, this just seems like a topic that so many in the public can relate to and understand. So we wanted to dedicate an hour to it.
Yeah, and it's the timing of this is always great, but I think this season is really valuable looking at specifically chronic stress. And Jessica, we know that stress comes in many, many forms. Everybody at some point experienced some type of short-lived or maybe acute episodes of stress when, say, taking an exam at school or maybe working on something, a project at work or preparing for an interview with a really important person. In these cases, we know that actually stress can be helpful. It can get your blood flowing. It can help you focus. But we also know that chronic stress is something entirely different. It's another story, and it can come in many sources, from many sources. Money problems. A lot of folks have a lot of financial struggles right now. Job pressure, right? Layoffs, political divisions. as well as the impact of racism. And maybe you got multiple things going on, right? So, Jessica, in reporting on stress, what did you learn about the sources of chronic stress? What are some of the most commonly causes that people feel when it comes to describing themselves as being chronically stressed?
Yeah, yep. And you mentioned a few of them, but I will say, so research that I've been really interested in comes from the American Psychological Association, and for the last 20 years, about 20 years, the APA has been releasing a Stress in America report, and it's based on this national survey where they gather information from people across the country about what stresses them out. And over the 20 years, with people sharing what stresses them out based on all kinds of things, these are people from all over the country. There are usual suspects that show up. So people kind of always are stressed out about money, jobs, maybe caretaking for their family. But as times have changed, stressors have changed, and more people are writing in answers about these big looming things that are stressing them out on an individual level. And so, unprompted, people are writing into a survey that they are stressed out about political division in the country. They are stressed out about the health of the economy. That is keeping people up, individuals up at night, thinking about that big idea. People are stressed out about climate change. Industries that came up a lot too. Industries that are changing due to changing times and technology. And a researcher or someone from the mental health treatment field would be better at talking about how common that is. But something that I find incredibly fascinating working on this program is that these big looming issues are deeply affecting individuals, not just things happening in their own home.
Mhm.
Well, so Dr. Doherty, we'll be talking more in a little while about the issues that you see in your practice concerning climate-related stress. But as a more general question, how does living with ongoing stress affect people's physical and mental health? How do you see that as a clinician in the folks that you work with?
Yeah, that's a great question. And I think what we're circling around on this talk is how to manage stress. And I think it would be, ultimately it's how we manage our consciousness. A lot of what we're talking about is people's consciousness raising. They're becoming aware of issues, obviously climate change and other problems in politics. And as Angela said earlier, not all stress is bad. In fact, we need stress, or we stress ourselves out to grow, to get stronger, to exercise. Um, so I think the way it affects people is in two ways. I think in a healthy way, when people have new information or they perceive a threat, they see it as an opportunity. They grow, they get stronger, they band together, they seek help. So there's a lot of healthy responses. And then I know with climate anxiety, eco anxiety, one of the biggest risk factors is isolation. So I think when we're thinking about unhealthy stress, it's often because stress is the perception. Unhealthy stress is the perception that we don't have enough resources to deal with something that is upon us, and that's what we're trying to combat. And part of that is talking about these things, making it okay for people to express their thoughts and feelings, but also connecting them with support and other people who think the same. So, in my work, I really try to attend to the threats and the problems that we're conscious of, but then quickly as possible bring in something positive and growthful and creative.
Mhm. And is stress cumulative? It seems like it must be to me, but in other words, if you're feeling constant worry about being able to, pay your rent and your health insurance program premiums, and you're Black or LGBTQ, and you're concerned about climate change and the changing environment around you. Do these things add together like an extra dose of a medication?
Yeah, and I think this can ultimately take years off your life and can contribute to chronic medical conditions and things like that. When we're stressed, there's all kinds of things that we do. In an evolutionary sense, when we're stressed, we would want to take action and have food and energy and things like that. But when we're sitting at home, people will overeat or eat unhealthy foods or have sleep problems and things like that. So it really, if we want to make a positive change, it does behoove us to take care of ourselves. One of the things I talk about in my book is that if we want to save nature, we have to recognize we are part of nature and we have to take care of ourselves. So sometimes I'll have people think of, well, what does the nature in me need, right? If you want to be an effective agent of change, you've got to take care of yourself, and that is not ancillary or extra. There is of course a tendency that people have to put their needs second in order to serve others, and that's very noble. But at a certain point, we need to take care of ourselves so we can be effective.
Dr. Sinatra, is there anything you'd like to add to that from your lens and your research?
Well, just that I agree with Tom that these are cumulative stressors. And I think the one additional thing I would add is that what we're seeing in particularly in young people, but in adults as well, as the internet and social media is such a big part of their lives, that is creating an additional stressor.
Hmm.
We see, all the suicide ideation we're seeing in young kids, teenagers, the social comparisons or the bullying they receive online. And this is particularly acute with people of color and LGBTQ individuals. And so I think that stressor is, as you put it, another dose on top of what we've already mentioned.
Okay. Jessica, one section of the stress show looked at the enormous stress that American farmers face, the intense financial pressures, fluctuations in price, upheavals in international trade from tariffs, the moves away from farming by younger generations. All this contributes to farmers' high rates of depression and suicide, and they are among the highest of any occupation. What did you learn about how farmers are coping with these challenges?
Yeah. So, farming is a really great example of how stressful jobs in industry can be that are going through uncertainty. And this was a really great kind of story about an industry and work as well. And it's important to talk about farming and about agriculture and unique issues there. But a lot of industries are experiencing what farmers are, which is they don't know what's coming. There are big issues that are
Mhm.
changing their work, like changing weather, trade markets, the economy, things that individuals can do very little about. And so we really wanted to highlight that and that uncertainty in jobs is something that is a very major stressor for people. But we know unique to farmers and folks living in rural parts is that farmers are at a higher risk for suicide and depression, and that's for a lot of reasons. That's due to occupation. That's due to geographic isolation, and we also know that there's still deep-rooted assumptions and discrimination about having a mental health issue in those communities, even though every year we hear that waves are being made. But those are still, deep into that community. And we also know from the research that there are huge barriers to getting care and that prevent people from getting care in rural areas. So it often prevents people from getting the help that they need.
Yeah.
Hmm.
So I know, I mean, it seems like it calls for some special, some different strategies and different ways of working. And I
Mhm.
know you talked to one therapist who specializes, who's really focused on working with farmers. She's in a rural community. What did she tell you about the approach that she takes?
Yeah, so Angela and I have reporting colleagues at NPR News that were on the ground with this story, Molly and Tadeo, and they heard from all the sources that they talked to, and that therapist in particular, that to help more farmers, mental health providers need to rethink about how to reach them and how they're getting care. Um, and that could be a number of ways. That could actually be physically how they're getting care. Maybe it's therapists going to farms for appointments, and that takes one less commute, meets them
Mhm.
where they're at. And also, since there's still this stigma that some people just don't want to walk into a therapist's office, that can help with that too. Other things that they heard is that more people living in farming communities could be trained to recognize mental health struggles and challenges, so deeper peer support networks. This therapist, Tracy Rutherford Self was her name. She actually was training bankers to
Mhm.
recognize mental health challenges in farmers, because bankers are often in tune to financial struggles and see in real time right in front of them when a farmer is really struggling because of financial news that they're getting. So she
I
works with
I
bankers.
love I love that part.
Yeah, it's really interesting, isn't it? And that it could be anybody in the community that can recognize it and could then have some tools to
Right.
follow up and resources. And then the other thing that came up, and this could be true in many communities, but that the mental health treatment field needed to train experts better to be able to uniquely handle the concerns in that community. And so, therapists that understand unique challenges in rural areas,
Mhm.
unique challenges that farmers are dealing with, and pressures, are going to they're going to earn trust more if they seem like somebody that understands, because we all know that it's really tough to trust somebody that you don't feel like just doesn't understand the outline of your life or who you are. So those were some things that they learned.
Wow. Yeah.
Yeah. I would
Yeah.
also just add that climate change is an additional wild card for
Yeah.
anyone who works with the land, whether it's farmer or someone who runs a vineyard, because
Mhm.
there are these larger trends that we can sort of predict, but it's a huge kind of question mark. So I think farmers are going to be more prone to that anxiety of the unknown threats than some other folks.
Well,
Mhm.
that's a really good segue. We weather is obviously a huge stressor for farmers, and it's greatly magnified by climate change. So that really is
Mhm.
a good way to kind of move into the second topic of the hour, which is climate change and mental health. Tell us, Jessica, a little bit about why you wanted to cover that topic in a Call to Mind episode.
Yeah, so we hadn't really covered that topic before. It was something that we were always seeing research on climate and mental health and how climate is impacting people with mental health issues. I was seeing this. Angela hears on another show that she hosts all the time about how young people are feeling about climate change and mental health and how it's deeply impacting people. And
We've had
get
when we've done stories on climate anxiety, they've been among our,
Mm.
most looked at stories for sure.
Yeah, yeah. So it's something that the public is really thinking about more and more and more. Thomas and Gale have been looking at this for a long time, so it's not a surprise to them. But it was just a topic that felt like there was great interest and that it would be a true public service to dive into.
Mhm.
And Dr. Sinatra, in 2021, we know that you published a book called Science Denial, which tied together decades of your research about the ways people learn, how they form attitudes and beliefs, and their ability to cope with new information that challenges them. And you also happen to live, at that time, you lived in Altadena, California, a community in Los Angeles County that was devastated in January of 2025 with the by the Eaton fire. You are one of the people who lost your home, and
Mhm.
I'm so sorry
Thank
that
you.
has affected your life in this way. For everybody who's new to your story, would you share a little bit just about your home, your community before the tragedy? Tell us about your home?
Sure. So Altadena is a very special place. It was an unincorporated community, which meant that um, African Americans were able to purchase homes there decades ago because it was not redlined. And
Mhm.
so it's a historically Black community, and it has been very tight and a very strong community for that reason. So people in the community have lived there for decades and have, passed down generational wealth in terms of the value of their homes. But also, those homes may have been underinsured or maybe even not insured if mortgages were paid off 20 years ago. Insurance may have been a luxury. And so there's many, many people who were underinsured or not insured at all. We lost over 6,000 homes in our community, and 20,000 people were displaced. And it's not just homes, but it's schools, churches, drugstores, post office, pizza parlors, restaurants. So it was difficult in particular for business owners and families. Children lost their home and their school all in one night. Some business owners lost their business and their home all in one night. So the community has this tight, strong network, which of course psychologically has been hugely important in the recovery because the community has really been very active in lifting themselves up and not getting quite as much support as they want from the state. And the attention seems to go a bit to Pacific Palisades, which is the community that also burned on the same evening from a different cause, but is the home of many wealthy people and movie stars. And that's gotten a lot of attention,
Mhm.
much to the dismay of the community. But the strength in the community psychologically has been a plus, and people have been forming informal and formal networks to help people cope with this tragedy.
So, Gail, when you were living in Altadena, were you ever worried that your house, that your home was, did you ever worry about the risk of a fire?
Well, in California, you're always worried about the risk of a fire. We had purchased the home because we understood it to be in a fire safe zone, which of
Mhm.
course isn't really a thing anymore.
Mm.
With
Mhm.
the extreme weather being exacerbated by climate change, the night of the fire, there were 90-mile-an-hour winds. That is extremely unusual. Santa Ana winds are common, but they are usually 40 miles an hour, 50 miles an hour. So this was essentially a fire hurricane, which is
Yeah.
not anything that anyone was prepared for. But also, I have to say that the community, it's disappointing to me as someone who maybe should have worked harder on this myself, given my knowledge of climate impacts, that the community was not prepared. And I think that's a lesson for all communities, communities that suffer from hurricanes, from floods. These extreme weather events are going to occur in numerous places, not just California, not just, Florida with hurricanes, not just the tornado alley with more severe tornadoes, but all over the country. And I think the devastating losses in our community are lessons to pre-organize, to also prepare your community in both structural ways, which I could get into that we didn't have and should have had. And also, I think social ways, making sure that the community is ready to go for such a tragedy.
Mhm.
A personal question, if I may ask you, I mean, what was this like for you? I mean, you're a climate impact expert, and now you are a fire survivor. As you look back, I mean, you're living through it right now. Like, how do you describe what this has been like for you personally?
I think it's very hard to describe. I think what's very unique about it and very relevant to our topic is that before we lost our home, I knew personally two people who had individually lost homes in electrical fires, and other reasons. And so I had known that it's extremely stressful and horrible to lose your home, of course. But I think what is incredibly different about a climate enhanced disaster such as the Eaton Canyon fire is that we didn't just lose our homes, we lost our entire community.
Mhm.
As I mentioned, we lost schools, churches, all the places where people assemble. So when you lose your home individually, you still have your neighbor's home and you still have your church and you still have your community group and you still have your school. And we lost everything all at once. And I think that is an order of magnitude that is really difficult to comprehend if you haven't been through it. And I hope no one has to ever comprehend it because I think that just is a whole different level to have your entire community wiped out in one night is quite a lot to bear. And psychologically,
Mhm.
tragically, we've had many suicides in our community. We've had, uh, they're estimating 400 excess deaths. And if you remember from COVID, what excess deaths mean, an atypical number of deaths. I know people who've had heart attacks and did not survive um, that may have been brought on by extra stress, as Tom was earlier talking about the amount of stress can be impactful on someone who already has, you know,
Mhm.
a pre-existing condition. So
Well,
it's
that's
been
what I was going to ask
devastating
you.
for the
Like
community. Sorry,
the
what?
mental health consequences for someone, I'm trying to imagine, like wrap my mind around losing all of my personal belongings, losing my home, losing my neighbors, but then also my school, my drugstore, my grocery store, my maybe my place of worship. So the mental health consequences is, I mean, is this for everyone something you carry for a lifetime?
Yes, I don't think it's something you ever get over. Like the loss of a loved one, you never really get over these things. I think what we are all learning, everyone in our community, and like I said, it's really tight, so we do get together and we do talk about things. I think what everybody is working on is just dealing dealing with the tragedy, like how do we all move forward? And I have to say that as difficult as it's been, the strength of the community has been very resilient, and that has been incredibly helpful. Everyone on my street is attempting to rebuild their homes. We're all sharing resources, information about architects and builders, and all the information. And that knowing that you're not alone in this is in some ways helpful. And so the strength of the community has in fact helped people cope.
So, I live in California too. We've experienced lots of wildfires around where I live in Northern California as well. And, these disasters just keep happening. And yet there's a good number of people who simply don't accept the reality of climate change and who reject the science behind it. I think for many people who do accept it, it's like it's shocking to believe that there can be such an alternate reality. Um, these two realities right next to each other, people living next to each other with different perceptions. So this is an area you've studied, Dr. Sinatra, and I wonder how do you address this phenomena, and what does it say really about the mental health impacts of this kind of polarization?
Yeah, that's what our book Science Denial is about with my co-author, Dr. Barbara Hofer from Middlebury College in Vermont. We talk about the different psychological reasons for doubt, denial, and resistance of
Mm.
science in general and climate change in particular. And there's all sorts of reasons. One of the main reasons is identity groups. And so as you mentioned, political polarization, science is unfortunately polarized. Climate science, in particular, is unfortunately politicized, and it's unfortunate because back in the day, Richard Nixon created the EPA, and Ronald Reagan passed the ban on chlorofluorocarbons. I always have such a hard time saying that word
Mhm.
to protect the ozone layer. So back in the day, there was bipartisan agreement that everybody wants to breathe clean air, one would think. But because it's been so polarized, and because there's been such mis and disinformation spread regarding climate change, we now have a much higher acceptance of the climate science in liberal and democratic groups than in conservative and ultra conservative groups. And this is not helpful because the climate affects all of us, and the climate doesn't know, just like COVID didn't know if you're a Democrat or a Republican, you can still get COVID. The climate doesn't know if you're a Democrat or a Republican either. And as I said, it's not just affecting, Florida and, you know, California. It's affecting all of us.
I want to talk a little bit about, how people cope with these disasters, and you've sort of referred to this a little bit. But, Jessica, I know you mentioned in the episode that as you reported on this, you went to a pancake breakfast on the anniversary of the blaze in Altadena.
Mm-hmm.
What did you see there that spoke to, to this kind of resilience that people need to get through these tragedies?
Yeah, so I was lucky enough that Gale met me and showed me around her neighborhood in Altadena, and I got to see where her house was, and that was really meaningful to me. And a few blocks away from where she lived, I met another group of neighbors, and it was this house that was kind of on its own. The lots around it were mostly gone. But this family was still there. They had to evacuate their house for a while, but they were able to be in their house, and they just kept getting together with their neighbors. They would have monthly gatherings with their neighbors. And when I started talking to them, they invited me to go to their pancake breakfast the next morning. And what I really saw was something that Gail touched on, which is that it was so important to all of them to stay connected. This group of neighbors, they see each other every month, at least once a month, and they stay in touch. Through a regular like text thread. And that those two things were providing very practical, emotional, and social support.
Mhm.
And it was good for their well-being. It was good for them. They could all understand what they had been through. And so that was something that they could be very vulnerable and share how it was actually going when they got together. They also were helping each other with things like, okay, here's, I have to put in for this insurance claim, and here's a hurdle I'm running into. Can anybody help? Somebody is applying for, FEMA aid. That was something they were helping each other with. And this group, and Gail, I'm curious what you have to say about this, but to this group, rebuilding and recovery meant much more than rebuilding just their home. It meant rebuilding a strong community. And candidly, when I was there, and you're looking around this neighborhood and seeing a lot of lots that are empty, and there needs to be a lot of work until it is a community again. My first thought was like, are people just going to leave? But seeing this strong community live together and support each other, I understood much more why they'd want to come back because that's all there. And so that was something that I thought was really special and definitely signaled how they were coping. And again, that there's a very different meaning to what rebuilding and recovery meant in that neighborhood.
Jess, you would be surprised how many homes are under construction since you were there.
Wow.
So, you are right that many more people are rebuilding than I would have estimated were possible. There are some homes already under construction in my area. And I think the number is several hundred that have been
Mhm.
started.
Mhm.
So it is extremely important to this community to rebuild the community. There's a couple of restaurants and a drugstore that have reopened. And so as places reopen, that's a place for the community to gather. And these community groups are gathering, as you mentioned. Some of them are small, like the one you mentioned, just that's a bunch of neighbors, and we have such a group as well. But there's bigger groups too that are meeting regularly. And I think that you're not in it alone is a very key part of people's recovery.
I want to make sure our listening audience knows, or if you're watching us as well, if you want to leave a question, if you know have something very specific you'd like to ask us, you can drop a question in the Q&A box there, and we will devote some time at the end of the hour to take your questions and try our best to answer them. Dr. Doherty, it's not hard to kind of grasp the mental health toll of losing an entire community or a home to destruction, like to a wildfire, my goodness. But climate change, I mean, it's affecting the mental health of people who have not lived through such experiences. You know, we're all kind of tracking and keeping, tabs on it. We're thinking about it, watching news coverage of it. So, Dr. Doherty, you work as a therapist with people who are grappling with this impact of climate change and feeling deep anxiety. I'm imagining maybe even grief. It could be described about what they're experiencing and thinking about what could possibly lie ahead. So, I want to know why do some people develop climate-related mental health concerns? What have you found?
Yeah, it's a great question, and it's a big question. One of my sayings when I'm teaching or working with people, when we're thinking big, we're not thinking big enough. So we have to keep kind of coming back and getting a grasp of all of these kind of issues. It's interesting because years ago, I mean, when I started working on yeah, as a psychologist, my interest was nature and mental health of the positive sort, like
Mhm.
why we love natural places and doing outdoor experiences. And climate change sort of intruded on my work, just like it's intruded on all of our lives. And that became the urgent thing to understand and work on. And when Gail and I have both served on the task forces for the American Psychological Association. I was on the first one, and she was on the second. And the first one was about 15 years ago. It was a different time when we talked about climate change. It was all speculative. Like, it was the age of the polar bear on the ice floe, something far away. And that's
Mhm.
changed. But what we recognized even then is that people are going to be affected by climate events, even if they're not personally in harm's way because of the media and because of just awareness. That research was based on findings after 9/11 bombings that people were traumatized by those events, even if they were not in New York or attached to anyone in that location. So the old model of disaster with a bullseye where it's worse at the center, and then as farther you go out, there's no effects. That's still true in Altadena in a certain level of system, right? As farther you go out in Los Angeles, there's less effects. But because of the media and because of our knowledge, it could be affecting people anywhere, right? So we do have this weight of emotion, the emotional responses, which we now know as eco anxiety or climate anxiety. And I think that those terms generally manifest in terms of fear and anxiety or in despair or grief. So those are the two broad reactions.
And I'd like to add to that that people who did not lose their homes in Los Angeles were incredibly stressed. They were
Mhm.
stressed by the events, as Tom said, just, vicariously and also just
Right.
because of fear, like, am I next kind of thing? And
What happened
also
here, right?
because
Mhm.
there were so many people who lost homes that most people in Los Angeles knew someone personally
Mm,
Mhm.
who had lost their home. And then even in Altadena, those individuals who didn't lose their home, they had tremendous stress because they had to mitigate the fire damage of their home. And then they were living in a community that was burnt down, and there was, health impacts of the smoke and toxins. And of course, they didn't have any services, water and power, and took a long time to come back. But then grocery stores, that was months and months and months before they had normal services of any kind. So people who didn't lose their home were also traumatized. So as Tom was saying, that this is a tragedy that was affecting people, even those who weren't. didn't lose their homes, or even those who weren't close to either of the affected areas.
Yeah, there could be
And Dr. Doherty,
survivor guilt, for example, and
Yeah, that
other
was a big
things.
one.
So each person has a unique story, you know.
I'm curious, how long have you been seeing people with climate related mental health challenges? I mean, when did you start to notice like the number of people like, expressing these type of concerns start to rise?
Well, you know, it's interesting because I got into this work. I used to do outdoor guiding and I was a river rafter and I worked for Greenpeace in the 90s. And so there's always been people concerned about nature of the environment. When I do groups with people, you know, older people will speak to, you know, Rachel Carson's Silent Spring book that came out in the 60s or Earth Day. So there's been a subsection of people in our society going back to the founding of our country that have been, you know, attuned to nature and protective about nature, the same people that created national parks and things like that. Um, and so, you know, this is a general connection with nature is general and it goes across politics and across groups. And, you know, climate change. I mean, for example, the first in use of the word eco anxiety, I tracked to around 2007 to media stories, right? It wasn't coming out of science, it was coming out of media. And it's interesting, the first use of eco anxiety was not around climate, it was around chemicals in the environment, endocrine
Mm.
disrupting chemicals. So it was this kind of
Mhm.
diffuse fear of chemicals. So that gives you a little sense of how this works for people. But then again, around 2007, 2009, Superstorm Sandy, the Camp Fire in California. So into the, or you know, by 2010, this was no longer abstract. It was affecting people, just as Gale's a living example. But you know, we're knowing people that have lost their homes. We are living through storms. Even where I live in Portland, a few years ago, we had fires that were, you know, 30 miles from my home. I had climate refugees living in my neighbor's home that were evacuating. So there's a stripping away of innocence, you know, that happens. So that's part of it. So this is really tracked in the last, you know, in the last 10 or so
Mhm.
years. So
But
now it has gone from anxiety of something in the future to something that a reality we're coping with now.
You're
the,
witnessing, right? Yes, Gail.
Mhm.
Mhm.
yeah, the
Yeah.
recentness of this that Tom's emphasizing in terms of how recent people are beginning to understand it. I want to point out, harkens back to something Jessica said earlier about clinicians needing preparation to understand rural farmers' mental health challenges. I just recently did a webinar with APA pushing us to better prepare and to help prepare practitioners to deal with climate anxiety and eco anxiety. Because, as Tom's mentioned, while this has been around, clinicians have not been sufficiently prepared to help people with these issues. And that's something APA is really ramping up its preparation for clinicians and practitioners
Mhm.
to be able to address these issues, because it's really it's happening faster than preparation of clinicians can keep up with right now.
A phrase I hear a lot more now is climate anxiety. And so I want to know, like, how is climate anxiety different than general anxiety? I mean, what does that look like? How does that show up in someone's life if it's deemed that they have climate anxiety, Dr. Doherty?
Yeah. Yeah, it's a great question. I mean, where to start is that anxiety is a normal, healthy feeling. So, you know, it's important to validate that it is quite normal for us
Okay,
to
so I'm
feel.
normal. I
Yes,
have
very
anxiety, so I'm
much
normal.
so. Very much so. Because people don't know because as we've talked about, I mean, again, to step back, we know that 70 to 80% of people in the US and every country recognize that climate change is an issue and they want their governments to take action. This is universal across the world. Despite the high profile deniers that we know about, that is not the norm. But most people don't realize that. And they feel alone and they feel despairing. But it's quite normal and sane to feel concerned about the future. That's a very healthy ability. So anxiety is like, you know, a warning light on the dashboard of your car. It's a signal to take action, to investigate a threat. And hopefully it's not that big of a threat, but we have to investigate it. So that's step one. Uh, but you know, it's easier to diagnose your car than to deal with climate change because it's a diffuse sense of threat that is again linked to all kinds of problems. Economy, as we've talked about economy, we've got a real crisis in the government in the United States right now at the federal level in terms of abandonment of taking action on this sort of stuff. So that's weighing on people. And so it leads to people to have this perception of a poly crisis or just problems in all direction. And again, we have to validate that. That is normal too. But we don't get stuck there. So what I tell people is don't get stuck in anxiety. That's the beginning. That's the doorway to awareness. But then you move into the doorway and you learn. Because for every crisis, there are solutions. And part of why I'm lucky and Gale and some of you all is because when you do this work, you meet fascinating, inspiring people that are doing great things. And so for every problem, there is actually many more solutions. So we need to keep moving in that opening direction. But for most people, it's more basic. It's okay. How can I cope personally? How can I adapt? In my book on climate change, there's a section on grief and loss, and I get deeply into that. And that's what brings people in the door. But what people find helpful is basic coping skills, understanding that these are their values. We hurt where we care, right? So if I'm concerned about something, I have a value. And if I can tap into that, that's a long-term sense of strength. And then,
You mentioned coping skills.
yeah,
So in this moment, can you give me some, paint a picture for me? I step into your office and
yeah,
what are some
yeah,
steps that we can take
yeah.
that would really
I mean,
promote healing?
one of my catchphrases working with people in general is validate, elevate, create. So you validate their concerns, you elevate them and say, let's talk about this as the most important thing, not your job, not other things, but your concerns about nature and climate and your story. And then you get creative about it. How did you learn about this? One of the most positive things about this work is helping people to express and develop their environmental identity, their sense of identity in relation to nature and the natural world, which is often quite deep. It goes back to our childhood and how we connect with place and nature. And we don't think about that kind of stuff. But when we do, it gives us this great well of strength, and then it's basic coping skills like how to think, like how do I get the right information? How do I not drown myself in negative news, which is mostly not necessarily an accurate view of the world. A really helpful realization for people is that I'm not alone. It's not my fault. Just because I care about climate change doesn't mean it's my fault.
Well, what about getting up and
Yeah,
doing something?
yeah.
Activism, climate
Yeah, I want
activism.
to I want to speak to that. I know
Hmm.
that Thomas knows and that taking action
Yep.
is very, very important. And I really want to mention that because I can see it happening in my community
Hmm.
in real time. That one way that people are coping is taking actions. Some people become activists, but it doesn't even have to be activists. I'll just tell you a little story of a woman in my neighborhood who was really struggling, and it was Christmas time, and of course, everyone in our neighborhood lost their Christmas decorations and Christmas ornaments. And
Mm.
she took it upon herself to do a little drive and get people to donate, Christmas ornaments. And then she opened her home to have everybody, well, not her home because she didn't have one, a place near
Mm.
her home for everyone to come. And everyone who went to that event were just like, oh, so grateful. And it was wonderful for the community, but I'm seeing the impact on her. The fact that she took this
With something.
action, which is, this isn't political
Mhm.
activism if that's not for you, but the action that she took to help people regain some Christmas ornaments sounds so small, and yet it was huge for the community and for her. So I think taking some actions, whatever they are, helping your community, all the way up to political activism, can make a very big difference in how you channel that anxious energy that you have regarding
Is,
climate and loss.
Hmm.
is part of
Hmm.
that because, just kind of regaining some kind of sense of agency, like
Hmm.
I can
Hmm.
influence the world around me. It's not completely hopeless. Because
Hmm.
I'm struck by, I know I've seen some polling that young people in particular are deciding not to have kids because
Hmm.
they don't want to bring them into a world that a doomed planet. And I just wonder how that like, I don't know, Dr. Doherty, if you see generational divides around that kind of issue.
Yeah, the answer is yes and no. Actually, when you look at the data, the amount of people that are concerned or alarmed or want to take action is actually quite similar across all the generations.
Hmm.
And the people that are in denial are actually quite small, but it goes across the generations as well. So the generations are more alike than we think. But again, they will have different priorities and different responses. And so each as a psychologist or a therapist, and when we're training therapists, we let them know that each age, whether you're children, adolescents, young adults, has its own type of stressors. So there's a whole developmental approach to meeting people where they're at. And people in their early 20s, 30s who are getting married, having children, that's a special thing. But elders can be, prey to despair, or so we want to meet people by the generations and where they're at. And so it's finding like with all mental health, it's finding the right treatment for the right person at the right time. Some people need to sit with despair. That is natural and normal. Other people get tired of that and they need to be like what I'd say post doom, where like, all right, I've already gone through the doom cycle. Now, what actions can I take? How can I be effective? Because I'm still alive and I've got time left. And then, taking time with that. Anxiety makes us want to rush. So there's a lot of these counterintuitive statements, times are difficult, we must slow down, right? So it's counterintuitive, but if we can give people even 5 minutes or an hour or a few days or a few weeks to slow down and think, then we're going to be more effective in action. Because as you know, taking action, whether it's writing a book or having a job, it takes time to figure that out. Some people, spontaneously do something great like the Christmas ornament thing. But for most of us, it takes a little time to figure out how can I plug in. So giving people a little permission, because there's so much shame and pushing people to take action. So honoring that, giving them a little permission to say, yes, how can you personally take action in your circle? That can be super helpful for people.
Something that you told us in our show was that you helped people learn how to do nothing sometimes, and that doing
Temporarily, yes. Yeah. Yeah.
that's an important qualifier, I suppose, to say too,
Hmm.
but that
Hmm.
sometimes learning how to pause and do nothing would actually help them
Ooh.
cope with their anxiety.
Yeah, I call that reclaiming your nervous system because our nervous systems are hijacked by these issues. And if we can reclaim our nervous system, heart rate, blood pressure, social supports, then we're going to be more effective. I mean, it's funny. I've been watching the basketball championships, and these athletes are working under intense pressure, but they're able to stop and breathe for a moment and then do their work. And so, can we get to that point of toggling between, engagement and really trying, and then stopping?
I just want to say, I don't know how anyone could breathe last night
Yeah,
watching that
yeah.
game, but that was unbelievable. But
Well,
I,
Bob, with your permission, we do have a couple of questions in the Q&A, and I would love to at least read one of these before our time is up. Is that okay?
yeah, please.
Okay. Dr. Doherty and also Gail, if you can both answer this. An anonymous attendee is asking this question. Can you talk about the effect of stressful news, the cumulative effect of stressful news? And this person says they're not directly affected by anything that we're talking about right now, but the news every day makes me stressed. And so we kind of began talking about chronic stress and the news. Obviously, if you're paying attention to what's going on, and thank goodness so many people are, it affects us, and it can affect our bodies, our physical health, and our mental health. What do you want people to know? Some advice about how to address what we're seeing every day in the news. Dr. Sinatra?
Well, I think we have to step back and limit some of our time on social media, and limit some of our time on doom scrolling, because as Tom said, a lot of the information out there is exaggerated or it's just simply mis or disinformation. And you're getting an impression of how bad things are, that may not be correct. So, an example would be that most climate scientists do believe we have time to take significant action and mitigate some of the worst effects of climate, but a lot of people don't know that. A lot of people think
Hmm.
it's too late and we are completely doomed. Well, if you're completely doomed, you're not really interested in taking positive actions and you're more depressed. So, I think one of the things people need to do is step back and kind of get away a little bit take a little social media break, take a little news break, and try to reset. Those quiet times that Tom was talking about where you're not doing anything might be a good idea.
Mhm.
Yeah, I would second that. I mean, we want to stay informed, obviously. So when we talk about taking a news break, it doesn't mean that we're burying our head in the sand. It just means that we stop the constant plugging in. I know people that as soon as they get up in the morning, the first thing they do is they look at their phone and they're wired in. And that's just not a healthy way to live in general. Yes, you want to listen to Minnesota Public Radio and do all the great journalism that we create. But, what I tell people is the news is outside your door. So go to your front door and look outside. Like here where I am in Portland, it's a sunny day in June. Yes, there are problems in the world, but right now there are birds flying around and bees buzzing around, and it's okay. So I can find present moment safety. And it's very difficult, if not impossible, to find a sense of present moment safety when you're looking at the news. So, and then keeping in mind that most news about climate is bad. About 97% of news reporting about climate issues is negative.
Mhm.
So there are problems, obviously, but it's not 97% to three. So we don't get an accurate view just from the news. That's why you need to organize and meet people and be in the community, because that's really also the news.
And apropos Tom's historical work, getting out in nature, just go take a walk, listen to birds. Getting out in nature has been shown to help people's anxiety levels quite a bit.
We're planning a series on sort of the nature prescription
Yes.
for folks as a mental health solution. Here's another question. Can you speak, and this is from a therapist, can you speak to the challenges of providing mental health care while at the same time not pathologizing being in pain about ecological destruction? I'm a therapist who sees people with climate distress, and I'm interested
Mhm.
in how it interacts with neurodiversity without being itself a pathology.
Yeah. Yeah.
Big
One of the
question.
juicy,
I think I'll leave it there for you
Big
to kind
one.
of reply
Yeah,
to.
it's a big one.
Yeah,
no, it's actually an answerable question. I mean, that's one of the juiciest questions about this is like, is eco-anxiety a diagnosis or
right.
things like or things like that. And the reality is that as I say, we have issues and issues. We have big issues in the world that we want to address, like climate change, and then we have our own psyche, our own psychology. And so, for some people, they might have tendencies toward anxiety or depression or ADHD or overwork or anything. So, part of this work in the therapeutic realm is to help people develop insight about their unique style. And there's a saying in grief work, we grieve in character, right? And so I've known Gale for a few years now before her disaster, but I already knew Gale was a capable person. So it's not surprising that how she's reacted to the loss of her home, because she's reacting in character. So understanding we each have an identity and a style. That's the beauty and depth of ecotherapy, is really getting into that kind of thing. In the old days, people pathologized environmental anxiety as just being it's really about your father issues or some sort of internal thing. And then we swung the other direction to say, no, this is normal. We want to empower people. And now in therapy, we're getting to the point where it's both. We want to empower people, but we also want to help those people that are really suffering with true anxiety or depression. It's not either or. So I say, validate and then engage and treat that small, high risk population.
And I know we're starting to go over time, but I want to get this last question in too, because this is something that also is getting a lot of attention. Chantal would like to know, what do you think about the impending impact of hyperscale AI data centers that are being built all over the country and the constant push for AI adoption by powerful people in our country? So as we hear the conversations about people being ethically and morally opposed to data centers and what it's doing to the environment, what are your thoughts, Dr. Sinatra?
Yeah, I'm glad that you asked me about that, because you may have seen on national news that Utah is at the epicenter of this crisis.
Where
Mhm.
you are right now. Yeah.
Yeah.
Mhm.
Yes, there's someone who wants to build a data center that the footprint is literally larger than Manhattan.
Hmm.
And you may know that the Great Salt Lake is shrinking, and we have a drought and water crisis.
Oh
So
my.
all of this is coming together, what we've been talking about this whole hour, eco anxiety, climate anxiety,
Mhm.
environmental challenges, and the political challenges of confronting this. The community has been very much against it. There's been numerous protests, a lot of pushback. Um, it is a very, very challenging moment. And these data centers not only have huge impacts on climate, but on energy, huge impacts on water, but on energy production at a time when, as we've been talking about climate change, we need to, push alternative energies that will help us to maintain where we are in this climate crisis. So Chantel is bringing up an extremely timely and important issue that does intersect everything we've been talking about.
Mm-hmm.
Dr. Doherty, the concerns, where do you stand with this?
Yeah, I think it's a really great present moment example of things. And I think, you know, there are ways to build data. We need, well, how would I say this? There are ways to build data centers that are better than others. And so I think that the focus is stopping just unhealthy and poorly planned data center expansion and figuring out ways that we can, I think it's Microsoft or Google has just signed a huge deal in Oregon to make a huge solar project to help with energy. So there are healthy ways to do data, and there are really illegal ways where companies actually build illegal, unregulated private gas generators. So we need to hold industry accountable for technology broadly, and that includes data centers. So I would say act to stop and then get better design.
Mhm. Rob, I know we're at the end of the hour.
Yeah, we are. And we want to make sure that as first of all, we want to thank everyone for joining us today. We want to thank Dr. Doherty, Dr. Sinatra. Really appreciate you being with us, Jessica, Angela. Thanks for helping me put this together. Um, Make sure to check out Call to Mind's latest season. It's up now. You can hear
Podcast.
in the podcast. You can hear five. I think it's five different programs,
Yep.
5 new ones.
and they're all available through Call to Mind's website. There are other
Call to
top.
Mind Now.
Sorry.
It's called calltomindnow.org
.org. Yep.
is the
Yes.
website. And then the podcast is just Call to Mind.
And yeah, and you can also check out MindSite News. It's MindSitenews.org. Go to our website. You can also sign up for our newsletter at mindsitenews.org/subscribe. And before you go, I believe we just dropped a short survey into the chat, and we'd be really appreciative if you it'll just take you 1 minute, but it really helps us improve these virtual events, these webinars that we do. And thanks again for being with us today.
Yeah. Thanks, Rob.
Thank you very
Okay.
much.
Thanks
Yeah.
for having me.
Thanks, everyone.
And what are the three words again, Dr. Doherty? Elevate.
Validate, elevate, create.
All right.
Good one.
There we go. Thanks so
Yeah.
much.
Thanks.
Bye-bye.